Good afternoon and good morning to those on the West Coast, and welcome today to the Segal Consulting webinar, The Cost of Healthcare, Findings from the 2015 Segal Health Plan Cost Trend Survey. Today's presenters, we have Ed Kaplan, Senior Vice President and National Health Practice Leader, and Andrew Sherman, Senior Vice President and Multi-Employer Healthcare Practice Leader. Andrew also works with a lot of our larger public sector plans, so he's going to add some perspective both for the multi-employer and public sector side through today's presentation. I think that's about it, and I'm going to turn over and start the presentation.
Okay, thank you, Guy. Ed Kaplan here. Welcome, and thanks for joining us today. We're going to get right into it, into the session. It should take about 45 minutes, even including your questions, but we can certainly run over if we get the participation. So first of all, I wanted to say the objective of this session, just to repeat them. So our session, we're going to provide some information about cost trends, health plan cost trends from our survey. Eileen Flick, our Director of Healthcare Technology, runs a survey every year with her team. And we go out to about 350 HMOs, health insurers, PBMs, TPAs, and it's really, what we do is collect the data on their predictions, so their actuaries and their underwriters. And really the results here are the reflection of their predictions. And then at the end, we'll provide some solutions and strategies to help you mitigate the trends, and we'll also talk about the impact of trend on the Affordable Care Act excise tax that begins in 2018, a very important milestone. Okay, before we dive into the actual numbers here, you see on slide 3, I wanted to explain how Segal defines health plan cost trend. It's a little different than some other consulting firms, actuarial firms, but similar to others. We define trend as the per member per month cost in healthcare trend before any changes, before changes in plan design, before changes in contracts, so renegotiating contracts or switching vendors for better pricing, any cost shifting, anything like that, any changes in the group demographics. So the pure trend, basically, if you do nothing, what will claim costs go up on a paid basis? And that's, for us, a better tool for our clients to look at to get those trends to actually see what, if they do nothing, which is what we start with, what will happen to their costs on a per member per month basis. So you can see here on slide 3 some of the big results. Healthcare trend is predicted to increase on a per member per month basis in 2015 in a range of 7.5% to 8% for medical plans. PPO plans are the most predominant plan for Segal clients and in general for most employers and multi-employer plans. Obviously, that's much higher than CPI. I looked today at the overall annual CPI for core goods and services, and that's still running at a 1.7% annual rate. So, again, we're running at 4 times the rate of overall CPI. We'll get into some of the reasons why their healthcare plan trends are always higher and sometimes significantly higher than the overall core CPI trend rates. Prescription drug card plans, we're expected to see an annual increase of about 9% for active and early retirees. That's a dramatic uptick that was running at about 5 or 6% the last few years. We'll get into the reasons of why that is, but that is a major pain point for many of our clients. And some good news is that on the Medicare side, Medicare eligible lives and Medicare Advantage plans, Medicare sub-plans, they're still running at a pretty modest trend of 3 or 4%. So good news there. If you have a lot of Medicare eligible retirees that you cover, the trends continue to be running at a good rate. We're going to get into the RX trends in a minute. The reasons behind it, but all of you probably know the story by now. Specialty RX costs are exploding. Brand trends, even non-specialty prices are increasing. And even generic drugs. I don't know if you saw the Wall Street Journal today, but there's been some alleged price fixing from some generic drug manufacturers, allegedly fixing and colluding on price increases, but we'll see what the real issue is on that. But anyway, there's many different areas where the prescription drug trends are rising. On the next slide, you can see here specifically for specialty drug costs on a per capita basis, this is a double whammy for many of our clients because the average increase in the cost per specialty drug is going up about almost 20%, 19.4%. And in addition, specialty drugs now make up a much bigger share of the pie of expenses for prescription drugs. For our average client, somewhere between 20 and 25% of all drug benefit expenses are now specialty drug expenses. We even have some clients that where specialty drugs account for 35, even 40% of the total drug spend. So if a third of your costs are going up by 20%, that is a major problem pushing up and really putting some wind in the sails of prescription drug trends. I actually think that the the estimated forecast of 9% trend is actually might be a little low for 2015. So for clients that have a heavy proportion of specialty drug expenses, that could be 10, 12, 14% next year. So things need to be done to address that.